Welcome to Health in Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show is designed to help women become champions of their own health care. Tonight we're going to take on a topic that really has made a major impact on women's health in both this and the last century. And that's the whole idea of birth control or contraception. Now, we are no longer at the times when you just used to have one birth control pill and no other options. Now there are many options, including brand name medications as well as generic medications, as well as other alternatives for what we call non-permanent birth control. There are also new ideas in permanent birth control. To help us to better understand some of these ideas, I have invited Dr. Colleen Bratch, an OBGYN at the Murfreesboro Medical Clinic and one of my partners. So I want to start by just saying thanks for being here. Now, in our first segment, I want to kind of take a look at the birth control pill. This has kind of been the old standard, brought out in the 1960s. So I want to kind of focus in this first couple of minutes about that. And my first question to you is, when a patient presents to you and says, I want to talk about contraception, where do you begin that conversation?
Sure. Well, women are so fortunate today to have so many options to discuss, and in order to sit with a woman and talk about the multiple options, it's really necessary to talk about the effectiveness of each method, its convenience, its reversibility, its cost, and its side effects. And once we can sit down and talk about that, we can decide which option is best for each woman.
I think that's great because, you know, it hasn't been very long that we could even discuss this whole idea of convenience. And, and it's become something in birth control or in basically contraception discussions. It is important that women are comfortable with the choice that they make. Who's a good choice for the pill?
Well, I think the most important factor for a patient is to determine if they're reliable. And when I say that, I mean, are they able to remember to take the pill the same time every day? Because the pill is only effective in preventing pregnancy if you remember to take it.
Yeah, I think that's important too, because I think a lot of women don't realize the way the birth control pill works is by preventing the egg from forming. So if you don't take it every day, that's when we get into problems. Who's not a good candidate for the birth control pill?
Again, if you're not a good pill taker, you're not a good candidate for the pill. Also, anyone that has a medical condition that excludes them from taking any type of hormones is not a good candidate for the pill. That would include people with a previous pulmonary embolus or blood clot, or some people with diabetes it's not recommended for. And let's not forget that women that are smokers and are over 35 really should not take the pill.
And one of the things I want to make sure we mention here is the whole idea of pulmonary embolus. That means a clot that travels actually from the legs to the lungs. So I want to make sure everybody understands that. Now, one of the other things I want to talk about is this whole idea. They're now generic medications. You mentioned cost as being an issue. There are generic medications and name brand medications. What is the difference between the two? And is one more effective, or are they both about the equal?
The effectiveness is essentially the same as long as you remember to take it. The major difference between generic and brand name is that the inactive ingredients they use may be different. The active ingredients, the hormones in them that prevent pregnancy, would be the same. The brand name have the benefit in that they are the newer medications. They're the newer progestins and estrogens that are discovered in different combinations, different amounts of time to take them, to have periods over a certain period of time, meaning there are pills that are new that you can only have 4 cycles a year versus 12, which for some women that's a great benefit.
And that brings up the point that I want to bring now, which is this whole idea of breakthrough bleeding. One of the reasons that people stop taking birth control pills is they worry about what we call breakthrough or unscheduled bleeding. What do you say to your patients that have that? Do you have any suggestions?
Sure. The main thing is that women understand when they're going to start any new contraceptive method that the bleeding is going to be not what is expected until you're on that method for approximately 3 cycles. And so that's the main thing, is that the patient is aware of that. The highest incidence of irregular bleeding occurs in women that are taking low-dose estrogen pills. So if they are on a low-dose estrogen pill and their irregular bleeding continues, my first recommendation is to increase to a higher estrogen dose pill.
And that's one of the things that's changed with birth control. We actually are now trying to find the lowest effective estrogen dose to try and treat these patients. Another problem that patients have is weight gain. Do you find that in your patients? I know in my patients, a lot of patients are concerned about this whole idea of weight gain. How do you address that issue?
Sure. Weight gain is always an issue for most women, especially young women. And all studies have shown really that the pill, the IUD, and the contraceptive ring all have no increased risk of weight gain. The highest method, the highest incidence of weight gain, is the method called the Depo-Provera injection. And in women that are very concerned about weight gain, I don't recommend that method.
Well, and that's interesting because I know a lot of women are really concerned, but there is no connection between the other ones and weight gain. It's only the Depo shot. And how much, because you always have this argument, the weight gain is fairly minimal, even on Depo-Provera, isn't it?
It can be. It varies from woman to woman. There are women that gain as little as 5 pounds, but I've had some patients that have gained as much as 50.
Yeah, I see that too, and it's always an interesting discussion as to what they do. The last thing I want to ask you about a little bit more about this is, to the patient who, for example, is on the Depo that has the breakthrough bleeding, what do you suggest to those patients if they do choose Depo, for example?
The main thing is, if it's in the first injection cycle, is patience. I think if you decide that that birth control method is for you, and you want to ride it out that first 3 cycles, that most times the bleeding improves.
Well, we've had a great discussion about the birth control pill and a little bit there about the shot. We're going to be right back. We're going to talk about some more alternative methods of birth control. We'll see you right after these messages. Welcome back to Health in Today's Woman. I'm your host, Dr. Kelly Williams. Tonight we're talking about birth control and the options that are available. In our first segment, we talked about the birth control pill. In this segment, I'm going to be joined again by Dr. Colleen Bratch of the Murfreesboro Medical Clinic. We're going to talk a little bit more about some of the alternatives to the birth control pill. For years, that's all we had was birth control pills. Now there are many different options that are available. So Colleen, that's where I want to kind of start. And I know we've got some different options here on the table. I want to kind of start with what are the advantages to using one of the alternatives to the birth control pill?
The biggest advantage is the amount of patient interaction needed with the remaining options that we're going to talk about. We're going to talk about the IUD and the Implanon, which have the advantage of they really only take one patient encounter to have great long-range contraception versus where we just talked about the pill and you had to remember it every day.
Okay. Well, let's kind of take a look, because the first one that I think is a big deal with that is the NuvaRing, and I'm going to hand this to you.
Sure.
But tell us a little bit about this. What is this device, and how is it used?
Sure. The NuvaRing, or the vaginal contraceptive ring, is a ring that has the same hormones as the pill embedded in the ring, and the ring gets placed in the vagina. A woman would put the ring in her vagina in a similar fashion as she'd insert a tampon, and it would remain in the vagina for 3 weeks, so she wouldn't have to worry about it for 3 weeks. She would take it out, have a menstrual cycle, and then put a new one in after her cycle was completed.
Now, since it's got the same hormones as somebody who's taking the pill, we've got the same contraindications or same reasons people should not take it. For example, what you mentioned earlier, the clots and things like that still holds with the NuvaRing, correct?
Correct. It's the same hormonal combinations, and therefore it has about the same side effects and benefits.
Okay. And who is a good candidate for this?
Someone who is not a good pill taker again, someone who doesn't want to have a device. We're going to talk about these other devices are actually implanted in your body in certain fashions, and so this is a device that can be put in and taken out, but doesn't have to, again, be remembered every day. And
one of the things I think it's important to know that if you do remove it, it can't be out for for over 2 hours. Is that correct?
Correct. It's 2 to 3 hours, unless if it's out longer than 2 to 3 hours, you need to use a backup method. And
a backup method means something like condoms or something like that.
Correct.
Okay, now we've got some other things here. I want to take a look at these others. We've got some IUDs. Who's a good candidate for the IUD?
Sure. The IUD is a great candidate. A great candidate for the IUD would be a person who is either completed with their childbearing and doesn't want to have permanent sterilization, or someone who is not completed their childbearing but wants to wait another 3 to 5 years to conceive again.
Okay, and we got 2 different types here. I brought one which is the Paragard and the other one which is the Mirena. What's the difference between these 2 types?
Sure. Let's talk about the IUD in general first. I'll hold this one up. The IUD is a T-shaped device that goes in the uterus. It's placed in the uterus, and depending which one you choose, the copper one is the one I have here, or the Mirena or the levonorgestrel IUD. Okay. They are T-shaped, placed in the uterus. That's what they're similar. They're actually the most cost-effective method available today. They've been studied for cost-effectiveness. The copper IUD, you can see, is wound with copper, and that is the way in which it inhibits pregnancy. Okay. The Mirena, or the levonorgestrel IUD, has a progestin in it, or a progesterone, that has a local effect at the uterus, and that makes periods lighter. Okay. The copper IUD is effective for 10 years, whereas the levonorgestrel or Mirena is effective for 5 years.
And so this one's being used, I think it's important to mention too, we're using this a lot more commonly in older women also, because not all birth control anymore is for birth control. Some of it is for cycle control or menstrual bleeding. And we're using these marinas in those patients, aren't we?
Correct.
At least I am.
Correct. And actually, it has just been approved for that use.
Yeah, because that's something that I know that's being discussed a lot in the medical literature. What's the difference in the two? What would, if a patient was looking to say, which one would I want? Give me some idea of who's a good candidate for each one of these and how they differ.
Sure. Again, if a patient has a contraindication or a medical condition that prohibits them from taking hormones, they would be a great candidate for the copper. The copper is a longer term use. It lasts for 10 years. However, it's associated with heavier bleeding. Whereas the Mirena or levonorgestrel IUD is associated with decreasing cycle bleeding and by a significant amount, so that would help with the bleeding as well.
Well, one of the things I want to make sure we discuss here too is that we talk about levonorgestrel, and what are we talking about? There are basically two hormones in your menstrual cycle. One is estrogen, the other is progesterone. The NuvaRing and the birth control pill have both estrogen plus progesterone, but the Mirena is only progesterone, correct?
Correct.
It's the same as the shot, the Depo-Provera shot that we mentioned before. Now, patients also sometimes will have some breakthrough bleeding on this one too. Correct. What do you tell those patients?
Again, I tell patients to be patient. In the first 3 months is the most likely time to have the irregular bleeding. The benefit of this watchful waiting is that 70% of women, by the time they have used the Mirena IUD for 2 years, will have only 4 episodes of bleeding a year.
Well, that's great. Now, we got one other one here, and that's the Implanon. This is something that you do that I actually don't do. Tell us a little bit about it. This is the device that's right here. I just want to show it.
Sure. The Implanon is a single rod of progestin, again, progestin only, that goes in the underside of the non-dominant arm. It's placed in the office under local anesthesia. It is good for 3 years. And a great candidate for this form would be a young patient who, again, is not a great pill taker, doesn't want to have to think about it, or for someone who, for some reason, it wants long-term contraception, wants reversible contraception, but is not a candidate for the IUD.
But this is a patient who needs to think a little more long-term. This isn't somebody who's thinking in 6 months, I want another child. We're really thinking a more long-term option, correct?
Correct.
Kind of like the IUDs. Now, this one, though, is one that we really can cut back and say, this can be removed at any time and start contraception earlier. Is that correct?
Mm-hmm.
Okay. Well, we've had a great discussion about some of the alternative methods of birth control in this with the IUD, the NuvaRing, and also the Implanon. When we come back, we're going to talk about permanent birth control and a new procedure that's been brought out to really provide women with a new option. We'll be back after these messages. Welcome back to Health in Today's Woman. I'm your host, Dr. Kelly Williams. In our first 2 segments, we've really concentrated on non-permanent forms of birth control. In this segment, I want to take a look at a new procedure, which really isn't all that new, that we do for permanent sterilization. And that is the Escher or Escher procedure. It is a hysteroscopic bilateral tubal occlusion. What does that mean? It means instead of making an incision in your belly button, which we've done tubals with for years, we can now place a camera in your uterus, identify the openings to the tubes, place place a coil in each of those openings, and prevent pregnancy. It is a major advance in women's health care. I want to show you an animation that I have that kind of gives you a little bit better understanding of what we do. So if you look at the screen now, you'll notice that we place a device directly inside the uterus, and then we place a micro insert into the tube. We'll do that on both sides. It is very unpainful. Patients tolerate it, and it's also done in the office, which is a great option. It does not require general anesthesia. Tonight, to help us better understand from a patient's perspective a little bit more about this procedure, I have invited Miss Christy Wood, who underwent the Escher procedure done by me, about 3 months ago?
Yes.
And has actually finished the whole procedure. So Christy, I want to tell you thank you for coming tonight.
Oh, you're welcome.
And we really appreciate it. And I have to tell you, and I've told you this before, the only bad thing about you getting the Escher is you're such a great mom and have such wonderful kids that we wish you would have more, but I understand you not having more. Let me start by just asking you at the beginning, Why did you choose this? What made you choose the Assure procedure over something else?
Well, we got to that point in time where we knew our quiver was full and we were ready just to know that we were done having children and to have a permanent procedure done so that we didn't worry about it. I come from a family where my grandparents had a child at the age of 40, and I could not picture ourselves at 40 getting ready to bring another child into this world. So we wanted to do something permanent that was easy, just to make sure that we didn't have that again.
And was it an advantage to you, as you saw it? Was it an advantage that we could do this in the office? Was that something that intrigued you?
It was. It was easy to go in and just have the procedure done just like a normal doctor's appointment. It was easier on my husband and on my children. I was not tied up at the hospital, and we didn't have any of that issues that go along with that.
And you know, one of the things I think people ask is a lot of people are afraid to do this procedure in the office. They think, oh my gosh, it's quote unquote going to hurt, it's going to feel bad. What was your experience with me doing it in the office?
Actually, it was not painful at all. I took a pain medicine pill before I came to help ease the pain. And then when I got there, I had a shot. That was very easy to do. It was nothing different than like a flu shot. And then as the procedure went on, it was nothing more than a little bit of a pinch. That was the total amount of my pain.
And were you able to resume your daily activities later on that afternoon?
I did. I went home, I took a nap for a little bit, and later on that day I was back to my normal routine.
And that's one of the things I think is so important. And one of the things that I like so much about this is most people will tell you that tubules hurt. Now, I've always told people this, that if you talk to people who've had tubules done the traditional way, they're going to tell you they're painful and I'm out for 2 to 3 days. You basically were up and moving around and doing your own thing by 4 or 5 o'clock that afternoon, probably?
I sure was, and that was important to me because with a 4-year-old and a newborn at home, I can't take the time to be out for a long period of time. So it was important that I would be able to just go back to our normal routine at home in a quick amount of time.
And let me ask something else. So one of the things that we do with the Assure procedure is that we do at 3 months, we repeat, we do an HSG, we do an HSG or hysterosalpingogram. And let me explain that to you. That's basically where under Flora, which is done in the radiology suite, we inject some dye into the uterus to make sure that those tubes are occluded. When you had that procedure done, did you find that painful, or how was that?
Oh, that was a very easy procedure. It was basically like getting an x-ray taken, just with some dye included. I went in, I was in there probably 20 to 30 minutes. I knew and had my results that day, whether or not my Assure process was complete.
And let me ask you this, if somebody came and asked you about the Assure procedure, what would your response to be to them as far as finding some positives about this particular procedure?
Well, we joke in our family that I did it so my husband didn't have to sit around on the couch for 3 or 4 days. Right. But I have recommended it to all my friends. I said it's a breeze. It's great knowing it's done and complete. I don't have to worry about that anymore. I was in, I was out. I have a number of family members who are currently looking into it in other states because they want to be complete with their family at this point in time.
And you know, this is something that I think we have such an important discussion about, because a lot of women are looking for something. They've traditionally done vasectomies, which are done in the office. This offers a little bit of a change from that and allows you to do it. Now, I gave you some medicine before the procedure. Was that advantageous for you? Because I actually gave you mentioned earlier, I gave you some pain medication the night before. That day, did that help you with it?
It did, and it was not hard at all. The pain was very tolerable, but it did just take the edge off to know that I was already taken care of before I went in there, and I wasn't going to have to medicate myself later on to cure for the pain I was already taken care of upon the procedure.
And the other thing, a lot of people get really nervous if they're going to the dentist. You've been to the dentist before, is, you know, people have that anxiety associated with it. Did you have that with this at all?
I did not, because it was an inpatient in the office kind of thing. It was not real hyped up. It was very low key. You go in, you meet with the nurse, she gives you your shot, and you move on to the next room. It was easy. It was not something that made me nervous at all.
Now, one of the things, and I can't remember if it was you, we did this with Christy, but one of the things, there is a contraindication to doing this, and that is a nickel allergy.
Right.
And if I remember right, we actually, with you, had to send you to the allergist because of the question about a nickel allergy. Is that right?
Yes, I did. I took a nickel allergy test, which was just a little patch that they placed on my back for 48 hours. Then I went back in and had the dermatologist read that. I was negative, so I could have the Assure process done. But I did have a little concern about that because in the past I've had some allergies with things like earrings and different metals, which had bothered me. So I just wanted to make sure that once this Assure was placed that I wouldn't have any allergy to it. So we just were preventative, took that step, had the nickel allergy test done, and it was a breeze.
And one of the ways that we figure out, and I've never mentioned this to Christy too, was the whole idea of, do you get irritation around your genes? And Christy had said yes, but I think that's important because some patients are concerned about this whole nickel allergy, and I think it's important that we bring this up that you cannot get the Assure procedure if you're allergic to nickel, but you're not going to set off the MRI machine. You're not going to set off the X-ray machine at the airport. Some questions that I think that people do ask, and the only contraindication that we know of, the biggest one is a nickel allergy. And if you think you may have a nickel allergy, it's important that you discuss that with your physician because your physician can then send you to an allergist to determine if you have that. When we come back, we will wrap up the show. We'll be back after these messages. Welcome back to Health in Today's Woman. Tonight we've had a great discussion talking about birth control. I want to show you on the bottom of the screen, we're going to have the website of the Assure device, the one that we had just discussed just a minute ago. I want to say thank you to both Dr. Colleen Bratch, who is an OBGYN at the Murfreesboro Medical Clinic, as well as Ms. Christy Wood, who is one of my patients who's undergone the Assure procedure. It is a major change that we have seen in contraception over the last probably 50 years, and we have further to go. So I appreciate you being here tonight. As always, please seek a physician of your choice for any specific medical advice. Thank you and good night.